Hello, my name's John Scott. I'm the Chief Operating Officer here at CUH. So winter is upon us and we're gearing up at the moment to make sure all our services are in place, ready for what will be a very, very busy season. People who've worked in the hospital before will know how busy winter can be, and I'm here to talk a little bit about the plans that we're putting in place. But first of all, what I want to say is a big thank you to everybody who's working in the hospital to deliver safe and calm care to all our patients. The work that you do is amazing, and you have a very important role in delivering patient care at high quality every day. And that patient care also translates into good working relationships and teamwork in the hospital. So thank you very much for that. In addition to all the measures that we've been taking that we know makes flow work in the hospital, things like discharging people before noon, discharging people at the weekend, and focusing on using the discharge lounge as much as we can, we're putting in more measures over the winter to help with the flow and keep people safe through this difficult time. So as pressure builds in the hospital, we have plans that will free up around about 22 beds that will give us the capacity to deal with the surges as they come in. Some of the actions that we're taking are things like using the Cambridge Surgical Movement Hub beds. There's some beds over there on Q2. We'll be converting space on C6. The integrated care system are putting in new plans to deal with patients who can move on to care outside the hospital, which will deliver about 27 beds to us. On top of that, our complex discharge team are working hard to free up an additional 14 beds. And all these things together will help us deliver safer care throughout the winter period. We are improving our discharge lounge capacity. The old boardroom, which is right near the main entrance, is currently being converted into an ambulatory discharge lounge for medical patients. We're keeping the discharge lounge in the ATC for surgical patients. And on top of that, we'll be using a bay on one of the medical wards as a discharge lounge for people in beds. All these actions will help move people out of beds earlier in the day and free those beds up for people waiting in the A&E and allow us to offload ambulances as quickly as we can. You will know that in previous years we've invested in creating a virtual ward so that patients can spend some of their acute hospital time actually in their own homes, supported by staff looking after them on a basis of going into their home and making sure that they're okay. We also use telemedics to keep an eye on these patients. The virtual ward has quite a significant capacity, up to 75 beds available. At the moment, we're using about 35 beds, so we've got room in the virtual ward to increase the number of patients there. On top of that, we are taking action to ensure that the infection outbreaks which we anticipate are well managed. One of the things that we've benefited from is from the Rapid Improvement Offer team coming to us to talk about infection control practices elsewhere. And they have pointed out that we can improve our speed of turnaround of beds for cleaning by investing more in what they call foggers, which are machines that dispense vapor into the air to clean all the surfaces in the room. At the moment, our foggers take about 3.5 hours. New foggers will take that down to 45 minutes. To help us make sure that we coordinate all these actions, we're setting up a Winterflow command centre, which will run every day to make sure that the actions that we're taking are done in a purposeful way to ensure that patients flow swiftly through the hospital. This will take patients' details from all over the hospital, and representatives of every division and corporate divisions will be in the room to see what we can do to improve the flow of patients, speed up the time that we can move the patients out of beds and move people up from ED into those beds. It's a really important thing that we're doing, but one of the most important things is what you can do. So when we look at our Small Things, Big Differences campaign, one of the messages I would point out to people is that every time you discharge a patient a little bit earlier, it makes a big difference. So even a patient discharged from the ward 15 minutes earlier than would have gone normally may feel like that's immaterial. But if you're a patient waiting for an ambulance, that 15 minutes can feel like a lifetime. So all these things that we're doing, all the actions that we're taking will build up to enable us to keep our hospitals safe and make sure it's as good a working environment for all our staff as we can possibly make it over the winter time.